chaotic time since 1935 when Social Security was first established to claim, start, and keep your Social Security benefits. So we're going to talk about that today, and this is also a live Q&A, so I'm going to, it looks like I already got a bunch of questions. I'm going to answer as many as I possibly can, but I want to go through some of the things that, why it's so difficult right now. DOGE seems to be they're newbies to Social Security. They don't know how the system works. They don't know how many people are dependent on Social Security. I mean, really, really dependent. Obviously, when you're a billionaire, yeah, if you don't get a check for a month or two, it's no big deal. They don't realize that millions of Americans depend on their Social Security check on a monthly basis to pay the rent and the electricity and pay for their prescriptions and all the rest of it. So it's extremely important that they don't mess things up. They're in there, as they always say, it's you got to break some eggs to make an omelet, but it's not their eggs, it's y'all's eggs, and you could very well suffer for a month or two without Social Security benefits if they do something wrong. They're talking about migrating the Social Security system, the computer system, to a brand new system. I got an email today, and the guy compared it to a stagecoach. When you're riding on the stagecoach and someone comes in and changes the horses while you're riding, he says it's kind of like that, only on steroids. So you got 73 million Americans receiving Social Security benefits, and these small team of people are going to come in there and change the entire computer system while the computer system is working. And there just might be hopefully some interruption. So we're going to talk about how to kind of prevent that and watch out for it and claim your benefits and all the rest of it today. Okay, so number one thing I want to reiterate, I'm going to be doing this a few times here, is do not go to the Social Security Administration in April. Doge and Elon Musk, they're in charge of Social Security. Make no mistake. It's now Doge's Social Security. They're in charge. The acting commissioner is a Doge person. Everybody in there is, that has the kind of the levels of authority are Doge people, and they are calling the shots. So the shots they called, they changed next day, and so it seems to be going on a daily basis. So the first thing that really freaked everybody out, stressed a lot of people, is that now you're going to have to go into the Social Security Administration to get things done. You can't do it over the phone. And a lot of people misinterpreted that because they did a terrible job in, putting that news out. A lot of people thought in order to keep your benefits, you had to go down the Social Security Administration. No, that has never been the case. What they were talking about, and again, they've changed, is that if you're filing a new claim, if you cannot file your new claim online and you want to do it on the phone, you can go ahead and do it on the phone, but then you have to go down to the local Social Security office to prove your ID. And everybody kind of misinterpreted that. They didn't do a great job of messaging. And basically, everybody thought everybody had to go down to Social Security Administration, and that is not correct. So don't go down to Social Security Administration. You hear that it's changed. They've pushed the date back. Before it was April 1st. It was going to be the worst, April Fool's joke in U.S. history. It's not April 1st now. It's going to be April 14th. But remember, that's only for people filing a new claim. But they changed that again. Only people filing a new claim for retirement benefits that can't do it online. So if you have a phone appointment, go ahead and keep your phone appointment, but the Social Security employee, the claim specialist that takes your claim for retirement benefits, and remember, Social Security considers retirement benefits, early retirement, delayed retirement credits, spouse benefits, divorced spouse benefits, independently entitled divorced spouse benefits, and survivor benefits. Those are all under the umbrella of a retirement claim. So if you have to do any one of those on the phone, then at that particular time, the Social Security employee will tell you whether you have to come down, because this changes on a daily basis, it seems like. I think they're going to make a change and change the fact that people are filing for survivor benefits probably won't have to come down because there's people, that are 70, 80, 90 years old that just lost a spouse that need to file for survivor benefits. And so they will need to come down. So a lot of those are automatic, but some aren't. So don't go down to Social Security Administration in April. It's going to be terrible. There's going to be a lot of people out there that don't get the message, and it's going to be inundated. And that's going to hurt the rest of the people that actually need to go in there and file for retirement benefits or survivor benefits or start their disability or get a missing check or start their Medicare or whatever the case may be. So it's going to have a domino effect and hurt a lot of people. A lot of people are going to be, it's April is going to be a terrible, terrible month. And because of tax season, we got a lot of people going to be going down the Social Security Administration offices, and trying to get the Social Security numbers for their children and stuff so they can file their taxes. So April has always been a very, very, very busy month. In my particular office I ran, April, the last 2 weeks of the tax season were always crazy busy because everybody waited till the last minute to get Social Security numbers. All right, so pass that on to everybody share, like, subscribe, and all that kind of stuff so people get that information so they don't waste their time, effort, money, gas going down to the Social Security Administration when they don't have to. Okay, so one of the other questions is, if you're going to file a new claim, when should you file? Social Security, you can only take a claim about 3 months before you want those benefits to start. So if you're going to be 62 next month, you're good. 62 the following month. In terms of 62, you have to be 62 the entire month to start benefits for that month for retirement benefits. But anyway, about 3 months before you can start benefits. Again, if you can do everything online, perfect. But DOGE is trying to push everybody to go online. That's the entire intent of this. That's why they fired a whole bunch of people, and well, they didn't fire them. They voluntold them to leave the premises, right? So fine, some people can file online, but the problem with pushing everybody to file online is all you have is if all you have is a hammer, everything looks like a nail, right? People say, well, I need to file for retirement, and Social Security is retirement and Social Security cards. That's all I know about Social Security is retirement and Social Security cards. No, that is incorrect. Social Security has a lot more programs than that. And if you just have that single focus of I need to file for retirement, I do it online, I'm done, then you might be missing benefits. And we see people in this channel come into the live Q&A all the time, and they say, wow, if I would have known that 5 years ago, I would have made tens of thousands of more dollars. Why didn't someone tell me that last year, 2 years ago, 3 years ago, 20 years ago? So that's going to get even worse going forward. So if you are going to file for retirement benefits, make sure you check your earnings record. Go in, set up a My Social Security account, check your earnings record. If you have any spouses, you're married to anybody that you were married for 10 years, currently married and they passed away. If you were married within 9 months, exceptions on all of that. But make sure you're filing for the right program. And that's why I've done over 1,000 videos and do this live Q&A on a regular basis to help people get the money that they earned and they need. So how to get the benefits? Again, you can file online. If you can't file online, then call, schedule an appointment, sit on hold for 3 hours, 4 hours. And, this is not Social Security Administration's fault. Social Security Administration can only work with what Congress, and I guess now DOGE, says. If you have a store and the owner of the store says, hey, you got 1,000 customers a day, but we're only going to give you one person to help those 1,000 customers, then whose fault is it? Is it the worker, or is it the owner of the store? Obviously the owner of the store. And the owner of the Social Security Administration stores are, well, it used to be Congress up until a few months ago, but now it's Elon Musk and DOGE. They've been firing all the employees that are supposed to be there to help you out. So that's why it's so difficult. There's really nobody there to help you out in a lot of cases. A lot of people have to wait in line, and if they don't get their benefits in time, they're going to lose that month, 2 months. One of the big issues is you're going to lose your Medicare. If you lose your job and you're past 65 and you want to go ahead and sign up for Medicare, if it takes you a month or two to get down there and get it set up and get an appointment, then you just might be without Medicare for a month or two, and therefore you're without your prescriptions, without able to go to the doctor and hospital. And so, the DOGE doesn't really understand the ripple effects of everything out there. Another thing I would recommend to keep your benefits is because they're going to be going in there and making massive changes to the computer system, and they don't understand how complicated it is. They think, oh, they're just, again, retirement and Social Security cards. That's what their main focus is on those Social Security cards. They seem obsessed with that, even though there's zero money comes out. They found zero money from those Social Security cards on the people that are deceased. Zero money. You notice that? Recent interview with Elon Musk and the team. Did they say, oh, there was billions of dollars going to people that were not actually alive? No, they didn't say that because they didn't. So there goes the biggest fraud in U.S. history. So they've been kind of proven wrong there. But there's a lot of computer systems that they don't understand, and a lot of computer experts have emailed me and said, yeah, it's not going to be good the way they're trying to do it. So here's what I would recommend. Go into My Social Security if you're able to go in there and print off everything. Print off your earnings record, make a hard copy of your earnings record, make a hard copy of how much you're receiving on a monthly benefits from Social Security, how much your projections are in the future. Everything you see in My Social Security, make a copy of that. If you're unable to go into My Social Security and get a copy of all that, then you can call the Social Security Administration and tell them, hey, mail me all of that, and they'll ID you and they can mail it to your a benefit verification, a work history, whatever the case may be. And they might give you a little flack on that, but please push and get that documentation. That way you're protected in case something does happen. All right. So to keep your benefits going forward, if your retirement, if you need to change your direct deposit, you have to do it online or go down to the local Social Security office. So if you're going to be changing your direct deposit, one thing I always recommend when you change your direct deposit, never close out your previous bank until the new check comes in, because somewhere along the line someone types in the routing number wrong or the account number wrong, and it goes off into Guantanamo Bay, Cuba, or wherever. Make sure your old account is still open. Make sure it goes to the new account before you close the old one, and that way you're kind of protected there. That way that the money's going to the right account before you close your other one. All right, because what will happen if they don't? If it goes off into someplace and it kicks back, then they will make arrangements to get you that money. But sometimes might take a month or two to get that, so be very, very careful. Surviving spouse benefits, spouse benefits, divorce spouse benefits. Same type of situation, work. Obviously, if you're going to be working and collecting any of those benefits, you're limited to the amount of money you can make. This year in 2025, it's $23,400. So if you're going to be going over that, you can call Social Security and do a work report, and they will stop your benefits to prevent that overpayment, because now they changed the policy that if you get an overpayment, you're not going to get any money. Previously, up until a couple of weeks ago, if you got an overpayment for some reason, they withheld 10% until it was paid back, unless you made other arrangements. Now they automatically hold back 100%. And you're like, oh, well, I'll just go down there. Well, good luck with that. If the office is open, whether there's staff there, whatever the case may be. So now that they've switched back to the 100%, if you get an overpayment, then you might be without a check for a month or two until they get it restarted. So it's important that you're a little bit more proactive in terms of early, reporting your work in case you make over the $23,400. The big two that is going to be a focus going forward is disability, SSDI, and SSI. SSI is supplemental security income. People think it means, Social Security income or something. No, SSI is a welfare-based program that the Social Security Administration administers. It's low income, low resources based on disability or aged. That means you're 65 or older. So there's going to be quite a bit of focus going forward on those, is, getting people that are on disability, making sure they're still disabled, checking to see if they're if they're still working. SSI across the board, because it's a welfare-based program. It doesn't come out of the Social Security Trust Fund. It comes out of general taxation. There's going to be a big focus on that. And you probably saw in social media land out there, some irresponsible social media people talking about there's millions of audits coming this year, and they're going to be kicking people off of Social Security with all these millions of audits. It's all BS. Are there going to be millions of audits this year? Yes. Were there millions of audits last year? Yes. Were there millions of audits 10 years ago? Yes. Those audits are called redeterminations, RZs, limited issues. Those are for people on SSI, the welfare-based program. So this year they've allocated, Congress allocates a special allocation of money to audit that. I think it's 2.6 million. Last year was like 2.4. And my office, we did, thousands of months of those. And those are just, if you're receiving those welfare-based benefits, did you win the lottery? Are you working? Did you recently get married and your spouse now makes $200,000 and stuff like that? So just to confirm that, you still are low income, low resource, and you're entitled to that SSI. You're eligible for that SSI, that welfare-based benefit. So yeah, don't freak out about that one. It's not Doge auditing people. And, we want to be fair to everybody. It's not them. Even the one about the guy passing away that Social Security said he was no longer amongst us in Seattle, a guy named Dan. That happens. That's happened every year of Social Security. Sometimes a funeral home or something types in the wrong Social Security number and someone is, marked as not being around anymore. So I don't think that was Doge or Elon Musk or anybody that did that. That's a normal occurrence, but a lot of, news sources picked it up and they blame them. So I'm not sure whether it was them or not, but that's a normal occurrence. Again, it's not Social Security. It's just, the funeral home types in the wrong Social Security number or something. And, some completely different person gets, vacated from the premises, I guess. Trying to keep my language for TikTok and all that kind of stuff. Anyway. All right. Let's see here. And what else? So let's move into some questions. So it looks like we got tons of questions. And remember, the question part here is always thank you to our sponsored chapters. So if you need help with all things Medicare supplements, Medicare Advantage, Part D plans, all the rest of it, reach out to them. And they will definitely help you out free of charge. And this is, you only got a couple more days. So if you have a Medicare Advantage plan, you have until March 31st. Yeah, a couple more days to check your Medicare Advantage plan, make sure you're in the right one, see if you can save any more money, get more doctors covered. You have until March 31st to double check that Medicare Advantage plan to make sure it's the best one for you. And if you don't do it within the next couple of days, then you're not going to be able to do it until October, and the new one will start in January. So you're kind of stuck with what you got until then, unless you move or, there's some exceptions. But yeah, you can reach out to, and you can also switch back to original Medicare and get a Medicare supplement for the next couple of days. You probably have to go through health underwriting, but anyway, depends on your state. All right. Will Social Security, Focus Lady. Hey, what's up, Focus Lady? Will Social Security penalize me? What is the prognosis for someone on SSDI? Age 54, when I was receiving medical care, I missed the long form CDR by 6 months. Okay. Yeah, the continuing disability review, I think they're going to be doing more of those, but that's a separate, again, as I mentioned, those are separate allocation by Congress. Congress every year says, hey, Social Security, we want you to do, 1 million continuing disability reviews to check to see if people on disability are still disabled. And then, so Social Security has to do 1 million. They can't do 999,999. They can't do 1,000,001. They have to do exactly 1 million. Yeah, it's crazy. Anyway, because that's how much money they were given to do that. And they save, I think every dollar they spend in those type of reviews for SSI and SSDI, I think it was last I saw was like every dollar they spend, they get $10 in return of savings for the American taxpayer. So, but they catch people that are working and, receive, and that's where the real fraud is. I mean, it's some of it's fraud, some of it's people, don't understand the complicated system. But, that type of fraud is not sexy, and you can't push one button and save billions of dollars. You got to press 1 million buttons for people across the country and see if they're still disabled and review their doctors and, check their bank accounts and see if they're still entitled to this. And yeah, it's a long process, but, Doge is looking to push one button and save billions of dollars, and they haven't found any, which kind of proves that Social Security is a pretty awesome organization. 1% of fraud. Can they get better? Is there more fraud out there? Absolutely. Can they improve customer service? Well, again, that's Congress. It's not Social Security. Social Security works with what Congress gives them, and Congress ain't giving them too much nowadays, and Elon is giving them less. So when I was receiving, I missed the long form CDR by 6 months. So probably it's probably not an issue, because what happens with those CDRs, your office, your local office, has like 100 quota, let's say, for that particular month, and they send out 200 packages because they figure a lot of those won't get back. So they probably sent yours and they've already filled their quota. And so they said, whatever. But I would probably reach out to them and say, you didn't really follow up, and I was kind of late, but I did return it. And they said, oh yeah, we've already filled our quota, so we shredded yours. So I wouldn't worry about it, but I would call them up just to make sure and say, hey, you're not going to stop my benefits or anything. So once they get a new quota from Congress, a new allocation for those type of resources, they might reach out to you again. And so just make sure you're on it this time. So shouldn't be an issue. If it was 6 months ago and nothing has happened since, then you should be good. When I filed for my Social Security, I had to go into Social Security office in person. Wasn't bad. Had good staff, kind and willing to answer all questions. Thank you, Mark. I appreciate that. Yeah. Congress has been trying to gut Social Security for decades. The Social Security now is a 50-year low in terms of staffing. Social Security Administration has been begging Congress, we need to update our computer system. And Congress, a few years ago, it was about 10 years ago now, they actually allocated money for Social Security to update their system. And then the new Congress came in and they yanked that money back. So, the computer system could have been updated 10 years ago, but Congress decided they didn't want to because they want it to be broken. There's a political party that wants Social Security to be broken, and that way they can say, look, we broke it, and now we're going to fix it. And it's like, wait a second, you're the one that broke it, and now you're going to take credit for fixing it. Come on. Yeah. I mean, we were born at night, but not last night, right? So yeah, thank you for letting us know. And Mark, give a shout out to whatever office it was, whatever district office, right down there. Say, yeah, tell us what office it was. Nice shout out for the people that are on the front lines. Does my FSA contribution, medical insurance payments, and deferred compensation lower my earnings record amount? No. Social Security goes by your gross earnings. So when you look at your W-2, it'll say, your Social Security wages, and then it'll also say your Medicare wages. They do a little different calculation of what's considered Medicare wages versus Social Security wages. They should never be allowed to touch this, especially shutting off our medical. If medical ends during transition of new systems, people will die. Yeah, and the new boss of CMS, the Center for Medicare and Medicaid Services, Dr. Oz, might be confirmed here soon, and I'm going to keep an eye on that, and see what kind of changes we're going to see in Medicare and Medicaid and all the rest of it. Are we going to get another stimulus check on April 3rd? I just heard from a person on YouTube channel. They said they were going to get $2,000 on April 3rd. Yeah, no. No. There is no stimulus checks right now. Maybe they're talking about the Doge dividend, and where Elon Musk says, hey, if we find, trillions of dollars of, money, then we'll give you all 20% of it and stuff. But, that's, not going to happen anytime in the near future, if at all. There are people that are receiving extra money in April, and those are the people that were government employees that work for state, local, some federal, city governments, that in those primary jobs, they didn't pay into Social Security. That's part of the Social Security Fairness Act. And if you don't know what a weapon, a GPO, and all that kind of stuff is, then yeah, it doesn't apply to you. I am completely against the Social Security Fairness Act. They should, they should come up with a Social Security Fairness Act and actually fix it rather than throwing the baby out with the bathwater. But anyway, stop the lies. Doge will leave nothing but rubble and hand the coffers to the oligarchs. Stop lying to the Amatakin people. So Central American tribe. I missed that. Maya. Anyway, Yahoo News today, people with a birthday January through May are getting an increase, and you just have filed at 62. Yeah, it sounds like clickbait to me. Doge's way of cutting Social Security, making it harder for the elderly to claim benefits. Yeah, that's definitely because there's cuts. There's just straight out cuts to everybody's Social Security check, and nobody's talking about that on the horizon, except for the automatic cuts that are going to be happening at about 2033 or 2034 because the trust fund is being used up. But another type of cut is exactly, yes, Alan, if you're not able to get the right check at the right time, that's essentially a cut. If it takes you 2 months to get in on the phone and get an appointment and start your benefits, you lost 2 months worth of benefits. So yeah, you are a liberal. I think you are left-leaning POS. Okay. Yeah, Social Security is a liberal left-leaning program. Yeah. So if you don't like it, return your check. Carol, I know that, but Social Security is not privatized yet. Yes. Yes, they are definitely trying to lean that way. And that's been a project since the 1980s. You go into my YouTube channel in the description and you can see the playbook that they're running by right now. It was written in the 1980s and it's going perfectly for them, not for us. Concerning independently entitled divorce spouse benefits, I was told years ago that I could not collect from both my Social Security and my ex-wife's Social Security until she is deceased. Is that true? That is incorrect, but it might be correct for you. So generally, that is not correct in the sense of you have to file for benefits on your own record. You get your own benefits. And then if you're entitled to spouse, independently entitled divorce spouse, survivor benefits, then most of the times you get yours and then you can get the other one, but one offsets. You don't get the full check. One offsets the other. So that's probably what you're talking about. In your particular case, Terry, probably they said you cannot get benefits on her record until she is deceased because your benefits are not less than half of hers. So in order to get benefits on someone's record while they're still out there alive and kicking, your benefit has to be less than half of theirs. But when that person passes, then that's out the window. When the person passes, if their benefit amount is $1 more than yours, then you're entitled to that $1. So it's the calculation. It's, living spouse benefits 50%, surviving spouse benefits up to 100%. So that's probably the calculation for you. All right, here's an interesting one. Dr. Christopher, what's up? Filed 564, 532 with docs, 1224 for 42,000 overpayment, error, pass and ticket to work, 2010. You mean probably SSA 561 and 632, but anyway. It's crazy that I still have that rolling around in my head up there. So that's why I have no hairs, because too many forms or friction. Reapproved Social Security 318, received approved no award letter. Can Social Security withhold 12 months underpayment, 2 months wow. So yeah, if you filed the 561, the request for reconsiderations where you're arguing that, you need to reconsider the nature of the overpayment or the calculations of the overpayment or whatever the case may be. And the 632 is basically, hey, all right, whatever the numbers are, I want to get them completely waived. Two things have to be met to get rid of an overpayment. One, it's not your fault, and that's a wide berth. And you don't have the ability to repay. So even if it wasn't your fault, but if you're able to pay $10 back a month, they're not going to waive it because you're able to pay back $10 a month. So if you file all that and you lose your battle, then the next stage after the 632 is asking for a personal conference, a PC. And you'll meet with someone, a claim specialist, and they'll go over everything. And then if you lose that battle, then you can go see an administrative law judge. So, but that takes about a year or two to see your time in court. Wife retired at 62. I will get more on her record as a stay-at-home dad. If I wait until full retirement age, I get 50% of her PIA, right? Yes, that is correct. Not 50% of her lesser amount because she took it at 62. That is correct. But as soon as you file for benefits on your record, then you have to file for benefits on her record. It's called deemed filing. So you cannot file for benefits on your record and then wait for you to reach, your full retirement age and file on hers, because you can't do that. You have to, as soon as you file for benefits on your record, you have to file for benefits on every other record you're eligible for. So hi, Ed. I can't afford a supplemental plan with my Social Security, but I can use a regular insurance with my Medicare to supplement my Medicare. Regular insurance, pretty much the only option you have is a Medicare Advantage plan. And everybody that watches my channel know I always recommend checking out a Medicare Supplement Plan N or G first, and then if it's not in your budget, like Kathytopia, just not in your budget, then a Medicare Advantage is far, 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 far better than just having Medicare alone. If all you have is Medicare Part A and B, then unless you've got a whole bunch of money under your mattress, then you're going to be in dire straits, because there's a lot of gaps in original Medicare. The big one is Medicare Part B. It's a 20% co-insurance. So if you get a $100,000 bill, you have to cop up $20,000. So if you have just Part A and Part B, you got to have a lot of money. You got to have a Medicare Advantage plan or TRICARE or Medicaid or something like that. So, or some people just do the VA or something. But you've got to have something else in there to protect yourself. Nikki, what's up, Nikki? I get both SSDI and SSI and get paid on the first and third by direct deposit. Will my payment date change and will I get mine on time? Yep, everything sounds, yep. If you're getting SSDI and SSI, you don't have to worry about anything, Nikki. Everything should come and get, unless, the Doge people go in there and, press the wrong button. But as of right now, you're good. Remember, because you're on SSI and SSDI, you might, you get a double whammy. You'll, might get the CDR, a medical CDR, to confirm that you're still disabled, whatever cycle you're on, 1, 3, 5, 7 years or something. And then because you're on SSI, the deal about those 2.6 million audits, right? They're redeterminations, the RZs as they call them. So you're familiar with all that. So just make sure you keep up on that. And it's going to be tough for people on SSI, particularly on SSI and SSDI, but SSI more, because they have regular interactions with Social Security. Once you file for retirement benefits, then, unless something changes, you pretty much don't have to contact Social Security ever again, unless you change or, move or direct deposit or miss a check or work, whatever. But most time, you're good. But on SSI, because of, the integrity and, Social Security trying to protect the Social Security, or trying to protect trust, or not the trust fund, because it doesn't come out of the trust fund, but taxation, American taxpayers' money, they do those reviews on a regular basis to make sure you're still eligible for that. So, and it's going to be tough because, the Social Security doesn't have a lot of staff. So please, understand that, and then reach out to your politicians and say, hey, how come there's nobody at my local office that can help? It's politicians' fault. Social Security can only do what politicians allow it to do. I just received a letter that they overpaid me and they're taking all the money back in April. Yeah, thanks. That's the new Doge thing. No heads up, and now I'm not able to pay bills. I didn't even know they overpaid me. Yeah, this is going to happen. And, to be fair to Doge and Elon, they are just reinstituting Prima Nocturna. No, they're just reinstituting a policy that existed during the first Trump administration, and they in the press release they said, which also was in the Obama administration. So Trump, interesting that they did a press release where they said, yeah, Trump and Obama did it. They put them in the same sentence. That kind of freaked me out. But that was a different time. 2 months ago, that was a whole different world for Social Security. During the first Trump administration and during the Obama administration and Biden and Clinton and Bush and all those, if you had an overpayment like that, they would withhold 100%. But at that time, you could go down to your local Social Security office and they would have staff. I mean, not as much as they would like to, but they would have staff that would help you and then say, oh, okay, let's set you up with an overpayment. Oh, this is not your fault. Let's go ahead and waive it. And you need a check. Let's go ahead and get you a check until, we'll give you a paper check out of the office, or we'll go ahead and push the button now and direct deposit will be in your account tomorrow. That's a different world. But now to reinstitute that 100% is not the same as it was under Trump, the first Trump and the first Obama. Because the Social Security employees are few and far between now. So that's, unfortunately, Darlene, you're going to have to venture down to your local Social Security office and, or call the 800 number if you can't make a trip down there. But they'll probably tell you that you're going to have to go down to the local Social Security office and get this addressed. So, that's an unfortunate part. This is all the moving parts that people that are new to Social Security that are making these wide-ranging policies and say, hey, we'll change that. And if we make a mistake, we'll learn and we'll fix it. Well, Darlene is like, go play, cowboys and Indians in someplace else. So I'm a widow. Husband earned Australian super. How do I handle that with U.S. income tax? I don't do taxes. I am 73. Sorry. I'm 73. I'm not sorry that you're 73. I'm sorry I don't do taxes. I never worked for the IRS, and I've been trying to cancel my subscription to the IRS for decades, and so no luck. So, Janet, what's up, Janet? I am 73. Husband is 69. He receives 2404. I get 1007. Can I get more? Maybe, but you are looking at your MBA. You need to look at the PIA. And a lot of people miss this and they're missing money. So Janet, you need to find out how much your husband's PIA is. PIA, primary insurance amount. That's the amount he would have received if he started his benefits at his full retirement age. And you need to look at your PIA, how much your benefit would be if you had started at your full retirement age. And that's the number you're looking at. So if those are the numbers, if those are your PIA and not your MBA, your actual check amount, if that's your PIA, then yes, you're entitled to more money. Yes. But make sure you're looking at the right numbers. And you're like, how do I know my PIA? You can go online to My Social Security or call the 800 number, 800-772-1213, and say, when you're both there, and say, hey, can I get any money on this guy here? And they'll check your record, and then they'll check his record. And if you're able to, then they'll schedule you an appointment and get you their money. So please explain how 35 years and years with zero affect the 40 quarters with 10 years. No effect whatsoever. Once you get 10 years, 40 quarters, that means you're eligible for benefits. You're entitled to retirement benefits, spouse benefits, survivor benefits. The 35 years is how much you get. So 10 years, 40 quarters, you're eligible. You're, as in private, they say vested, right? But how much will you get? That's where the 35 comes into calculations. So they look at your high 35 years of earnings. And they, dudes, this is pre-recorded. He'll never answer our questions. No, sorry about that. Bites mightily. I've got tons of questions here and other, formats here. So sorry, I've got hundreds of other questions. I'm never going to get to all of them, unfortunately. But the high 35 years of earnings, what they do is throughout your life, they look at your high 35. If you made $20,000 when you were 17, you're like, oh, that's definitely not a high 35 because I made $80,000 last year. No, they index that for inflation. So that $20,000 when you made it in 17 is probably worth $140,000 now. Like a wage index, they index it. So, and then they average it. Your average index monthly earnings. So a 0 year, If you've only got 34 years, then they still divide it by 35, 420 months. So yeah, so a 0 year will bring it down a little bit, but yeah. Let's see here. What else we got here? Be prepared not to get your check for at least 2 weeks, and who really knows how long? Yeah. Yeah, I mean, if the Commerce Secretary his mother-in-law didn't get a check for a month, and it's like, oh, okay, well, no big deal. Well, yeah, if you've got a billionaire son-in-law, I'm sure it's no big deal. But a lot of people, unfortunately, don't. So, bites my mistake. Apologies. Yeah, no problem, no problem. Yeah, it's how much approximately should we plan on paying for Medicare with all the parts? Oh, good question. Thanks, Jill. So Medicare Part A for most people is free. Well, it's not free. You paid for it all your life. Now it's 0 premium per month once you start it for most people. And why do I say most people? If you have 10 years, 40 quarters, then you're eligible for 0 premium Medicare. But if you only have 39 or 30 quarters of coverage, then you can get Part A, but you have to pay for it. But 99.9% of people get Medicare Part A, 0 premium per month. Part B this year is $185 per month. And then again, if you just get Part A, Part B, it's $185. If you get a Medicare supplement plan, which is the ones I recommend checking out first, anytime you're getting ready for Medicare, you just lost your health insurance from work, or you're 65 or whatever the case may be, and you're going on Medicare, whoever you talk to, you can talk to my partners at Chapter there, they can help you out. But whoever you talk to, say, I need to start, checking out plans, Medicare plans that will cover all the gaps of original Medicare. Please tell me about Medicare supplement plans first, Plan N and Plan G. And then probably the agent you're talking to will say, oh, darn, they wanted to sell you a Medicare Advantage because they make more money on that one. But check out a Medicare supplement plan first, and those cost money. And that's why 51% of people don't get a Medicare supplement plan, because they can't afford it in their budget. So it really depends. A Plan N is about 20% a month cheaper. A Plan G, it depends on where you're living. Anywhere, an N and G is about $80 a month, $100, $120, $140 a month, depending on what state you're living in. If you're in New York, it's twice, 3 times that. So that's a Medicare supplement. And then if you have a Medicare supplement, then you'll also need a Part D plan, the prescription drug plan. And those can be $5, $10, $15, $20, $30, $40, $50 a month. Okay, if you don't want the Medicare supplement because it's not in your budget, then you do a Medicare Advantage plan. And then you have original Medicare, Part A, Part B, so that's $185. And then you get a Medicare Advantage plan, and a lot of those have 0 premium. And you're like, 0? How can they do it for 0? Well, because you already paid for it. All those decades you pay into Medicare through your FICA, through when you worked, you paid Medicare. When you sign up for a Medicare Advantage plan, that company, whoever you sign up for, they take their little begging bowl down to Washington and say, hey, we just signed up Jill here. And, all that money she paid into Medicare, give us that, and so the government gives that Medicare insurance company, a certain amount every year, as long as they're taking care of your healthcare needs, or a reasonable facsimile thereof. And Medicare Advantage, a lot of those are 0 premium per month, but they do have costs, ongoing costs. So it's kind of, if you go to the hospital, it might be $100, $200. If you get this prescription, they might do a co-insurance or deductibles. If you go get go see a specialist, it might be $35. So there's ongoing costs. If you know that you're going to live the next 50 years and you're never going to get sick and never be injured, then I would 100% recommend a Medicare Advantage plan. Get yourself a 0 premium Medicare Advantage plan. Don't pay for a Medicare supplement plan, but that is if you got a perfect crystal ball and you know the future. If you don't, then I would definitely check out a Medicare supplement plan first. That's my personal opinion. But anyway. Let's see. Dr. Ed, Musk apparently has done so much damage inside Social Security that I'm hearing that he wants to update to a new system. His, of course. He wants to run all of our information through his AI Grok. Yeah, Daryl. That's I just mentioned Medicare Advantage. Medicare Advantage is privatized Medicare, and Medicare Advantage plans. The reason a lot of people don't like them is the whole prior authorization thing, the limited network. So you can only go to the doctors and hospitals they tell you can go to. If you don't, then you have to pay a whole bunch more money. They can second guess your doctor. If the doctor says you need this, that, or the other, the insurance company says no. And their AI, they got busted a few years ago for having their AI make that decision rather than an actual doctor. So Medicare Advantage is privatized Medicare. And now they want to do the same thing with Social Security. So do you want Social Security Advantage where you can only go to their people and get your disability or retirement or survivor benefits? And if they say, no, then yeah. So yeah, I'm not a big fan of that. So, will my Medicare premium go up when I sell my house and buy a new one? It depends how much you get. Your Medicare Part B premium and the Part D premium, you're talking about the Irma income related monthly adjustment amount. That's a higher premium for high wage earners. And there's exceptions to that. Is what, $250,000. If it's over that, then talk to your tax person. But if your capital gains on your house are high enough, then you just might pay an extra Part B premium for 1 year. It's only for 1 year. And if you disagree with it, then you file an SSA 44 and say, hey, I disagree with the extra charge on my Part B, and they will take a look at it again. Nifty Kitty, how can I get my SSDI back pay in one lump sum? I am eligible for SSI benefits for $12. I cannot have a lump sum payout. I have to take payments in 3 separate payments, which is 1.5 a year. Yeah, because it's an SSI type thing, Social Security, part of the policy that Congress wrote. They say they can't give you the lump sum, but if you have some type of extenuating circumstances where you say, hey, yeah, I understand, it's my back pay, and because I'm on welfare based benefits, yada yada yada, whatever the case may be, but I want that lump sum because I'm going to do X, Y, and Z. I need a new car. I need an air conditioner. The summer's coming here pretty soon. I need, this medical whatever, and just reach out to the person, your claims specialist that works in your local Social Security office that you usually deal with, if they're still there, if they haven't been, vacated from the premises, or just reach out to another Title 16, another SSI person, and say, hey, here's the deal. And usually it's no big deal. Usually they'll be able to do it for you if you've got a good reason. So I've had a Brood to the Last Drop asks, I've had a SSA online account for many years. Do I now have to create a new account with a new format, and does all my info get transferred over to the new account? Yeah, you should have gotten that word, many months ago, that Social Security was switching to a new system. And it's really, really good. It's a nightmare, but the reasons it's a nightmare is because it's more difficult to get in, and which is good because that protects you. It protects you, from someone in somewhere else in the world pretending to be you and going in there and causing you trouble. So it's you do this thing where you've got this. I did it, and I did it like really early in the morning, and the person on the other side is some private company. They have like ID you, where you put your ID, your driver's license, up to your forehead, and they look at your driver's license and your face and see if they match. And so, yeah, you might have to do that. And in terms of the information, yes, it's all the same. Yep, it's all the same. So just new formats. But yes, definitely do that. So what website is there talking about differences between states getting advantage and supplemental plans? Thanks for all you're doing. You're welcome, Oregonians loving Portugal. Okay. What website is there talking about difference between states getting advantage and different website? Not sure about website that, I mean, well, there's tons of websites out there, insurance company websites that, tell you the difference between Advantage and supplements and stuff like that. And then there's Medicare.gov. But you can always call up Chapter. They're 100% free. And the great thing about Chapter is why my son and I chose them to help y'all out is because, they're impartial. They, whatever plan is good for you is, they don't care. If it's good for you, it's good for you. It's good for you. And they have a member success team. So if something crazy happens next month and you get some kind of weird bill, or the company denies, or you need to find a new doctor or something, they're one of the only places that we found that really have a really good team, a member success team that you can reach out and say, hey, I got this weird letter in the mail. What the heck does it mean? And they'll walk you through it and stuff. So yeah, definitely reach out to them. Maxine, what's up, Maxine? I'm 62 years old and will be collecting my first retirement Social Security in May. Congratulations. Wanted to know if I'm eligible to collect my husband's retirement. He is 68. If your benefit amount is less than half of his, it sounds like y'all are still married. So the 10-year marriage thing, not relevant. That's only for divorce. But yeah, if it's your current spouse, and if your benefit amount, your full benefit amount, if you had waited till your full retirement age is less than half of his, then absolutely. So, what's going on with widows benefits? Been drawing since 2019. No change. Yep. Well, there was a change, then a change, but anyway, but that change didn't apply to you in any way, shape, or form. You're good. So if you're collecting widows benefits, then you don't have to do anything unless you want to, change your address or change your direct deposit or something. But if you're good, you're good. Go on with your life. Enjoy it. One thing I will say though is remember you're on widows benefits. If you never touched your benefits on your own record, remember your benefit amount will continue to increase until you reach 70 years old. So the month you hit 70 or before that, if you're receiving the widow's benefits, widower, surviving spouse benefits, all basically the same, and you never touched your own benefits on your own work record, you need to contact Social Security and see if that's more. What offices throughout the country do is they run this report every now and then. It's called a WIB-RIB report. WIB, Widows Insurance Benefits, RIB, Retirement Insurance Benefits. It's basically offices throughout the country, and unfortunately, because there's no staff, it's going to be missed, and people are going to lose money because of it. A letter goes out if you are receiving surviving spouse widow benefits, and you'll get a letter from Social Security, and it'll say, hey, you're receiving those benefits, and the computer just looked at the numbers, and it looks like you can get more if you switch from that to your own retirement benefits. And the letter doesn't go out. It gets lost. It goes to a wrong address. You moved, didn't update your address. You get the mail and you think it's just more garbage. You don't understand it. You think it's a scam. And there's so many people out there, widowers, that are eligible for more money and just don't know it. So if you know somebody around you that's receiving those type of benefits, reach out to them and say, hey, did you ever see if you're eligible for more benefits on your own record? And they said, no, I don't. And says, well, I mean, did you work? And did you work basically as much as you did as your deceased spouse? And I said, well, actually a little bit more, about the same. Call the 1-800-772-1213 and check to see if there's more money on your own record, because it's not automatic. You actually have to file a new claim. So I have a Medicare Advantage that covers everything, and it costs me nothing. It actually paid $100 monthly towards my Medicare. Chapter helped me find it and sign me up. Okay, awesome, Mozart. Yeah, those are, most companies have that, not only that particular company. I don't like mentioning company names, but anyway. Yeah, that's called a Medicare Advantage Part B giveback, and that's one thing people, particularly that use the VA a lot, or kind of healthy-ish. Medicare allows these companies to pay for your part of your Part B. So he or she got $100. So you sign up for the Medicare Advantage Part B give back. It's 0 premium per month. And on top of that, they pay for part of your Part B, $50, $75, $100, $185. So it's not a bad deal. And that's one thing I would definitely recommend for veterans, because Doge is looking about cutting, 80,000 people, employees from the from Veterans Affairs. And you might be happy with, your health coverage now at the local VA, but when they lose a whole bunch of employees, your health coverage might go down. So, you know, get a Part A, get your Part A. You probably already have Part A if you're receiving Social Security benefits, but maybe you declined Part B because you were happy with the VA. Well, that might be different now. So maybe you might want to get Part B, but unfortunately, you only have 2 more days because the general enrollment period ends March 31st. Yeah. But you can reach out to Chapter and they can see if there's one of those plans available in your area and see if they can help you, get set up. Leatherneck, USMC. I think Dr. Ed's setup is relatively lean, so might not have the ability to do that, but the video has been showing recently has the Brett Baer softball Doge interview on Fox. Oh, okay. Yeah. Hey, take and took. I think I missed a Leatherneck's question there. I did a video yesterday, the audio on I played the Brett Baer interview, and I'm going to do kind of a mock interview of Elon Musk, or anybody on the Doge team, ask them real questions. So I think I'm going to do a video in the next couple of days where I ask them the questions that they should be asked about Social Security. And I'll tell you pretty much, I know what the answers are before I even ask the questions. Unless they completely lie, then I don't know what the answers will be. Social Security does not show the income from the years that I was under CSRS system. Do they have that information, or do I have to find out? Kelvin. Anyway, yes, and that's the reason for the Social Security Fairness Act, and that was the reason. Well, that was the reason for WEP and GPO, the windfall elimination provision in the government pension offset, is because they didn't have those numbers in the regular system, and that's why. Anyway, because CSRS didn't tell Social Security before 1983 what those numbers were. So yes, they didn't have them. So you need to reach out to OPM. Please address different names when filing for divorced survivor benefits. Rosalind. Yep, no problem whatsoever. If you have your Social Security card, your internal, you changed your name 1, 2, 3, 4 times. Whatever your name is on the Social Security card when you file, that's the name they're going to use for you collecting benefits. And if you want to change it at that time, you can change it. You have to show, that, you went back to your old name in the divorce decree, and they can change it that way. You can, a new marriage certificate that you changed it again, whatever the case may be. So as part of the claims process, when you're filing for benefits on divorced spouse or surviving divorced spouse, whatever the case may be, then you can change your name at that time as part of the system. So, but you have to have some type of proof of, that you changed it legally. Question: how long does it take to update request for application withdrawal? Simply being me. Under normal circumstances, under the normal Social Security world since 1935, couple 3 weeks. Now, all bets are off. It depends whether your local office has staff to even help you with that. So, yeah. Let's see. I am 63, and if I marry my guy who is 74 and he gets $3,500 a month, my benefit would be $1,550, not started yet. If that is his primary insurance amount, then possibly. You won't get half because you're 63. You're going to get a reduced amount. You have to file for benefits on your own record, and then you can file for the spouse benefits, but because you're 63, you're not going to receive the full 50% because anytime you take money from Social Security early, except for like disability, then your benefits are always reduced because you're starting those benefits early. So, all right. Oh, thank you very much, Retired Life Mexico, for the super chat, $4.99. Thank you, my son and I. Thank you, appreciate it. How does one know that they have been overpaid? You'll know. You'll receive a letter. And so if you're retired life in Mexico, make sure you got an address in the United States or Mexico or something that you get your mail, and or do a virtual post office box or whatever the case may be. And then if they'll send you a letter and they'll say, hey, you're overpaid, yada, yada, yada. And then make sure you address it as sooner rather than later. So, all right, we are out of time. Let me do one more question here. I have a phone appointment on Tuesday. This is for DAC benefits. So DAC benefits are disabled adult child benefits. That's for someone that's filing on a parent's record and that child became disabled before the age of 22 years old. So I receive SSI and SSDI. In your opinion, should I go ahead and apply for this due to the time it may take to get approval? 100%. If you think you're eligible for those benefits, you're receiving SSI and SSDI on your own, but your parents, recently filed for retirement benefits or disability benefits or passed away, I would 100% start the process as soon as possible, because it's going to take forever. When I was taking disability claims, everybody at that time said, hey, you'll get your answer in about 3 to 6 months. Recently, it's been 6 to 9 months, and now all bets are off. Yeah, so it's unfortunate. But yeah, so start the process immediately, if not sooner. So, all right, it's over an hour and I have run out of time. I apologize, but I will be back again tomorrow and come up with another topic and answer a whole bunch of other questions. Y'all take care. Please share, subscribe, like,